Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it, or add it to trainings that are already being held. To date, we've held almost 20 virtual screening events. We've engaged thousands of participants, and we look forward to hosting more events in the coming year and engaging countless new participants. Tonight, we are thankful for you, our amazing CADCA members and guests, and we're specifically thankful for tonight's co-hosts, Mary Forsyth-Tabor and Brian Mooney from the Making It Happen Coalition in Manchester, New Hampshire, and they are making it happen. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we'll hear from a wonderful group of speakers here in New Hampshire who are working every day to save lives. We're honored for them to be part of this event. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how we can use this technology to better save lives and create a norm that every life is worth saving. Lastly, we would love your valuable input while learning from you all in attendance today, how you would use this virtual reality format in your communities. From these events, we plan to learn how to use technology to better save lives. So again, we would love your valuable input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a few questions at the end of the hour, and if you'd please type your answers into the chat, we appreciate your input. Additionally, in the weeks to come, we'll reach out to you all as a group to get more input from you as well. Now, I'm pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined our team at CADCA over a year ago and has been working ever since to help further CADCA's mission of building and maintaining safe, healthy, and drug-free communities. We're thrilled to have him here with us at CADCA and appreciate him being here today to speak with us. Valentino?
Thank you, Reiko. As you stated, I am thrilled to be here for this very important event. I'd like to personally thank Walmart for their investment in not only this technology, before their investment in the people who will benefit from this life-saving training. I'd also like to extend a special thanks to our co-host, and I love their name, the Making It Happen Coalition, who has been a great advocate and ally of CADCA for many years, and it's an honor to be on with them and other leaders from the great state of New Hampshire. Finally, I want to thank everyone on today's webinar. We hope this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 coalitions across the United States. We have sought to train community residents and leaders to build and develop coalitions in communities and reduce substance misuse by adapting CADCA's model for community change. We're now entering a hopeful and promising stage in the country. We are vaccinated, boosted, and committed to having life return to normal. We must use this energy, this new shot of life, to stay motivated and create innovative and groundbreaking strategies to address substance use. Tonight's webinar is a great example of that. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. Prevention has become more important than ever. Recently, the CDC reported that over 104,000 drug overdose deaths occurred in the United States in the 12 months ending in September 2021. This is the largest number for a 12-month period ever recorded. To put it in perspective, that number is almost the size of Manchester and nearly 12,000 more people than the population of Nashua. Sadly, it's estimated that the number will increase. This is tragic, and we have to do our level best to right this ship. As life returns to normal, it is important to work together as one. One nation, one goal, one CACA. One CACA is a call to action. It signals that the participants within this movement must unite and come together as one if we are to win. Together we are stronger, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. You are the true heroes in your community. The conversation being had today on the webinar is a unique one. Our partners at the Drug Enforcement Administration recently launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. Let it be known, if you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. Keep up the great work that you are doing. I look forward to seeing you in person the next time we're all together. Thank you for having me on today. Back to you, Reiko.
Thank you so much, Valentino, for those remarks. We welcome you and appreciate you joining us tonight. And now it is my pleasure to introduce our first speaker. Our first guest speaker tonight is Agent John Delena. Mr. John Delena is a member of the United States Department of Justice Senior Executive Service and currently serves as the Deputy Special Agent in charge of the Drug Enforcement Administration's New England Field Division. In this role, Mr. Delena has oversight of DEA operations in Massachusetts, Connecticut, Rhode Island, New Hampshire, Maine, and Vermont. Mr. Delena is in his 30th year of law enforcement, 26 of which has been spent with the DEA. We're so pleased to hear from him tonight.
So first off, I'd like to thank my great friends and partners at the Making It Happen Coalition for Resilient Youth, along with the good people at CATCA, for putting on an incredible event like this, which, right now is so critical in the community surrounding New Hampshire. Nobody has seen the devastation created by this drug overdose and poisoning crisis more than the people of New Hampshire. And we're at a point right now where it truly is a clear and present danger to all of our citizens. It affects our public safety, our public health, and our national security. And that's why it's so important for events like this where we can reach so many people to talk about the threat. So what I'd like to talk to you today about is particularly the dangers of fentanyl and the ways that these drug trafficking organizations are masking fentanyl and tricking users into thinking they're getting something like a prescription grade pill when in fact they're getting something that's laced with fentanyl. Every day we wake up in New Hampshire and really all throughout New England and sadly all throughout the country, and we read about the devastation and the toll that this is taking on all of our friends, families, neighbors, and we're living with it every day. And that's why communication and transparency and getting this message out there right now is more critical than ever. We all have 107,622 reasons to be here today, to be having this conversation here today. There's nobody that I've come across in New Hampshire and all of our communities that hasn't been affected by this crisis in some form or fashion. I can remember when I first started doing these types of events in New Hampshire and the overdose death numbers were around 75,000. And to watch them rapidly increase every year and to be at a point in the United States of America where we have 107,622 people dying from a drug overdose, it's absolutely devastating. But it's why we need to have a call to action like this and to get people to talk about things like naloxone and the ability to save lives and how important that is in all of our communities. DEA is out there along with our state and local partners, and we have such great relationships throughout all of New Hampshire, and we're doing this work every single day. The amount of fentanyl that we're seizing now in the communities around this area and in the four corners of New Hampshire and across the United States is absolutely incredible. I mean, we've seized enough fentanyl to kill every single American. And if that isn't a message enough to get people speaking about this and talking about the dangers, I don't know what is. You've all seen this image before. You know how dangerous fentanyl is. You've seen the comparison next to a penny. We're talking about, such a small amount that could be a lethal dose, enough to fit in the tip of a pencil. I don't think enough people understand that, especially young people. We need to make sure that we convey that message everywhere we can. This has to be discussed not only in our homes and in our schools, but in our faith-based organizations. We have to have teachers, coaches. Everybody needs to be having this conversation with everybody so they can understand just how deadly this drug is. And, this is truly what I wanted to talk about today because, while it's not a new threat for New Hampshire, it continues to grow. And that's the ability of these cartels, these insidious cartels, who are manufacturing pills to look identical to a pharmaceutical-grade pill and lacing it with nothing but fentanyl. And DEA right now, in the pills that we test, 4 out of 10 of those pills contains what we've identified to be a lethal dose. And I can tell you that we are seizing these pills throughout New Hampshire every single day. And they're taking steps to make the pills look better. Even law enforcement, even the most experienced DEA agent can't tell the difference when it's first seized. It isn't until we get it to the laboratory that we get a test that we're able to determine that it does in fact contain fentanyl. And this is what's scary to me, is that they have made the move to target young people. The gloves are off. The cartels are actually coming after our children. They're doing it when you look at a drug like Adderall. We know that Adderall is a drug that is widely used and prescribed appropriately to young people, but it's also widely abused and traded among students in middle school, in high school, and even in college. So when the drug traffickers have now taken a drug like Adderall and they started manufacturing it originally in New Hampshire and putting methamphetamine in it, but now we're seizing it with fentanyl in it. And that's just, how deadly it is. And then even the street dealers are saying, hey, buy this Adderall, it'll help you be a better student, it'll help you be a better athlete. And then, by the way, if you have trouble falling asleep at night, take one of these Xanax. This will help you calm down and help you fall asleep. When in fact, both of the drugs contain deadly doses of fentanyl. This is what a laboratory is supposed to look like if you're manufacturing fentanyl. If you're manufacturing something that's ending up in a legitimate pharmacy or at a hospital, this is what a clean medical grade laboratory looks like. But this is what we end up seeing in places like Mexico, when in fact this is where they're manufacturing those same pills and that same fentanyl that's ending up here. These are in the jungles, covered, by a triple canopy, and there's no oversight. There's no rules or regulations that go along with it. And that's why these pills, in fact, are so deadly, because they can't regulate how much fentanyl ends up in each pill. And that's why we see, oftentimes users will share a pill, and one person may suffer a deadly overdose and the other person doesn't. It's because in the pill itself, if you get that corner of the pill that has too much fentanyl, you're going to overdose every time, which again is another reason why having naloxone, available and in all of our communities is so important. The ability to hide these pills right now, especially when transporting them, is incredible. If you look at an image like this and you see over 1 million pills contained on a small shelf like that, that's how easy it is to have over 1 million doses. And if you do the math and you think about that, 4 out of 10 of those pills contain a potentially deadly dose. Do you want to take that chance? Do you want, your children to take that chance? DEA took some steps recently, which I'm so proud to be a part of, but we sent out a public safety alert, first of all, talking about just how deadly this drug is. And then we took another step and we put out to all of our law enforcement partners, because we're continuing to see what we call cluster overdose deaths, where we're seeing multiple people in the same general area, either the same home, at the same party, or at the same, at the same street, that maybe bought drugs or pills together, and now multiple people are overdosing. And it's so important right now in New Hampshire that we have this conversation, because not only is it the fentanyl that we've been talking about, and not only now is it the fentanyl that's being hidden and tricking users into buying these pills, but we're seeing fentanyl now laced in things like cocaine, in things like methamphetamine. The drug traffickers will stop at nothing. They're okay, creating somebody who will become addicted to drugs like fentanyl. They don't want a part-time cocaine user. They want a full-time fentanyl user. And along the way, if they happen to kill some of our citizens, they just don't care about that. the last thing I want to talk about is the availability of these drugs on things like social media. If you have a smartphone, if you have a computer, these drug traffickers are now in your home, and they're reaching out specifically on apps like Snapchat, Instagram, Facebook Messenger, and they want to contact our young people especially, who they know are on these platforms, and they're making these drugs readily available. Conversations need to be had at home. DEA has published what we call an emoji decoder. It doesn't necessarily mean if you see these specific emojis on your children's phone that they're buying or selling drugs, but it is something that you need to be aware of. Please access this information, familiarize yourself with it, and have this conversation. Lastly, I just want to thank everyone again for the opportunity. New Hampshire continues to be, in my opinion, the gold standard for how we do things, how we respond to this, and an event like this is just further evidence of it. So thank you very much for your time.
Thank you so much, Agent Delena, for your remarks, for educating us here today, and just for the incredible work that you are doing every day to help keep our community safe. We truly appreciate you speaking with us today. Next, we will hear from David Mara, who is Governor Chris Sununu's advisor on addiction and behavioral health. David Mara has more than 3 decades of experience and contributions to the law enforcement field. He served as chief of Manchester Police Department, the largest department in the state, for more than 7 years, and as interim chief of police for the Portsmouth Police Department. Chief Mara has served as the governor's advisor on addiction and behavioral health for the past 5 years and continues to oversee statewide responses fighting the opioid epidemic. He earned his Bachelor's of Science degree from Northeastern University and his law degree from the New England School of Law. We're so excited to have you here with us tonight, Chief Mara, and we look forward to your insights.
Hi, everyone. My name is Dave Mara. I'm Governor Sununu's advisor on addiction and behavioral health. I'm here to talk to you today a little bit about what's been happening in New Hampshire concerning overdose deaths, and fentanyl in particular, as well as a new initiative that we're going to be rolling out during the upcoming school year. It's going to be a fentanyl awareness program. Now, according to the CDC, there were 108,000 drug overdose deaths in 2021. Overdoses are now the leading cause of preventable death among people ages 18 to 45. That's ahead of suicide, traffic accidents, and gun violence. In comparison to the rest of the nation, New Hampshire has been fortunate in that overdose deaths have remained flat the last couple of years. But that doesn't mean that we're resting on any kind of laurels. It doesn't mean we're not concerned, because back in 2021, 425 people lost their lives. Based on those findings, an average of at least one person died every day from a drug overdose in New Hampshire in 2021. Opioid deaths have significantly increased due to the common street drugs laced with fentanyl, including pills, cocaine, crack, heroin, meth, MDMA, and cannabis. Basically, they're mixing fentanyl with everything. Fake prescription pills are widely accessible and often sold on social media and e-commerce platforms, making them available to anyone with a smartphone, including our kids. Recently, fentanyl-laced pills shaped like grenades and alien heads in bright colors like purple and green were seized by law enforcement in the neighboring state of Maine. The use of characters and coloring is an obvious attempt by the drug traffickers to increase the appeal to our youth. Youth are more likely to swallow the drug than inject it, and youth who use pills are less likely to have access to Narcan. So if they do overdose, there's a less chance of them being able to be brought back with that life-saving drug. In light of the increasing threat that fentanyl presents to our youth, we are developing a public awareness campaign called No Safe Experience. The campaign will be paid for with ARPA funds and administered through the Department of Safety. We are planning on partnering with the Department of Education, Safety, and Prevention specialists, as well as engaging youth while developing the campaign. The purpose of the campaign is not to scare people, but it's to increase awareness of the dangers associated with drug use, including marijuana, counterfeit prescription pills that have been mixed or tainted with fentanyl. A No Safe Experience website will be developed and contain more information concerning the dangers of fentanyl and links to SUD resources that are available. Posters, pamphlets, and other printed materials will be developed and distributed to middle and high school, colleges, universities, liquor outlets, and DMV locations. Strategically placed billboards on the state highways that warn users of the increasing prevalence of fentanyl and illicit drugs will also be used. No safe experience lesson plans geared towards middle and high school students will be developed in partnership with the Department of Education for inclusion in health and advisory classes and made available to private schools and parents who homeschool their children. We want a campaign that is designed not to scare people, but will resonate with parents and youth and emphasize the point that when using unprescribed drugs, there's no safe experience. If anybody has any questions or any suggestions or recommendations concerning this new campaign, please contact me and I'd be glad to speak with you or send me an email at david.mara@nh.gov. Again, that's david.mara@nh.gov. Thank you, and I appreciate the opportunity to speak to all of you, and I wish you well in your efforts.
Thank you so much, Mr. Mara, for speaking with us today and for your tremendous work in New Hampshire. Now we will turn our attention to Matthew Barter. Matthew Barter is a lieutenant with the Manchester, New Hampshire Police Department and serves as a chief of staff for Chief Alan Aldenberg. He's an experienced police supervisor and a champion of evidence-based policing within his agency. Lieutenant Barter is a collaborator who strives to partner with diverse stakeholders to solve difficult problems. He has successfully developed and implemented data-driven and evidence-based violent crime reduction strategies, including through his engagement as a National Institute of Justice Law Enforcement Advancing Data and Science, or LEADS, scholar. We'll now hear from Lieutenant Barter.
Hi, my name is Matt Barter. I'm a lieutenant with the Manchester, New Hampshire Police Department. I'm excited and happy to be here today with you to talk about some of our opioid overdose outreach efforts through our community response unit, which is a project that we partner with the Manchester Health Department on through a framework we call FAST, Public Health and Safety Team. And it's a great partnership that has allowed us to really fill a gap of outreach for post-overdose situations. And so how this works is anyone who overdoses in the city, police officers respond to it along with fire and EMS, and the police officers document who was involved in that overdose. We then have a team that consists of 2 police officers and a community health worker, and often a peer recovery specialist that go into the field to follow up with the individual who had overdosed and try to connect them to services. One of the key components of this effort is a leave behind kit that we provide to the individual who had overdosed or their family member, if that's who we make contact with. And in these leave behind kits is a number of resources to include naloxone and information on how to use naloxone so that we can make sure we have adequate public access to naloxone in the hands of the people where it's really going to be most impactful. And so far in our efforts, we've been doing this outreach effort for about a little over a year now, and we've been able to supply over 500 leave behind kits out into the community and deploy those out. And we have anecdotal evidence that these kits are being used to reverse overdoses and save lives, and that's great. Even more promising is some of the results we've seen from our initial evaluations of this overdose work. And what we have found is during that first year of this program being out there, public Narcan use in Manchester has increased 56% compared to years prior. And so that's significant. Overall, we see that in about a third of all overdoses, there was public use of naloxone by someone in the community before public safety officials arrived at the scene. And when we compared that to some comparison studies that aren't doing similar efforts, we saw that was much higher than those comparison studies. And we also have seen that our fatal overdoses, while they have trended up recently, were less than comparison studies that also saw similar increases in trends. So we are excited that this is a promising effort, this post-overdose outreach, and we think we are being impactful in the community. When we are out delivering these leave behind kits, not only are we able to provide valuable information in connection to services, but we're also able to educate family members and associates of folks with substance use disorder. And through that, creating that education in the community, we're hopeful that it really makes a difference for those that need it the most. So we're fortunate to have received additional grant funding to keep this overdose work going throughout the next couple of years. We're going to continue to evaluate our efforts, make sure that what we are doing is working, and make adjustments where needed. But certainly naloxone and public access to naloxone is an important component of this and something that we're going to continue to focus on. So I thank you for the time. Certainly, please feel free to reach out to me or anyone from our teams if you want to learn more.
Thank you, Lieutenant, for taking time to speak with us today. We really appreciate you giving us this insight and just taking the time to be with here on this very important initiative. We are excited that next up, our speaker is Anna Thomas, who is the Public Health Director of the City of Manchester's Health Department. Anna Thomas is a New Hampshire native and has been with the City of Manchester Health Department for the past 28 years. She was nominated by Joyce Craig in 2018 to serve as a public health director for the City of Manchester, making her the first woman to hold this role. In her work, she provides administrative oversight to a comprehensive and innovative local health department with a mission to improve the health of individuals, families, and the community through disease prevention, health promotion, and protection from environmental threats. She holds a particular passion for neighborhood health improvement, resident mobilization, and economic mobility. Anna completed her undergraduate work at the University of New Hampshire, completed her Master of Public Health at the Harvard School of Public Health, Johns Hopkins Bloomberg School of Public Health, and the Dartmouth Institute for Health Policy and Clinical Practice. She was selected as one of the 20 National Scholarship recipients by the Center of Disease Control and Prevention to obtain her graduate certificate in public health. Additionally, Ms. Thomas served in the U.S. Army for 16 years as a Medical Service Corps officer and achieved the rank of Major. Lastly, in 2021, she was named Citizen of the Year by the Greater Manchester Chamber. We look forward to hearing from you, Anna.
As Public Health Director of the state's largest city, our department knows that community-wide access to naloxone not only prevents loss of life, but is cost-effective. For years, we've been on the front lines of fighting the addiction epidemic alongside our community partners. We've done so through outreach teams, dissemination of naloxone to the public we serve, as well as equipping some of our public schools to keep on hand. As the city's chief health strategist, and from our most recent community needs assessment, we have seen a dramatic increase in the use of naloxone by a bystander in suspected opioid overdose cases before the arrival of a first responder. We've learned from other communities that by working together, it strengthens our impact in all that we do. And working across disciplines is helping to create a unified front in our urgency to save lives. In partnership with the Manchester Police Department, we have formed a public health and safety team of community health workers who visit those we know have recently overdosed or who are at risk for overdosing. These teams outreach with police officers who are in plain clothes and volunteers with lived experience to conduct welfare checks, as well as meet individuals where they are at in their addiction and recovery journey. We also know that networking with family members or those who have a positive influence in these individuals' lives adds a layer of reinforcement to our intervention efforts. We teach these caregivers how to administer naloxone and also provide them with supporting resources for when their loved one is at a point of readiness for treatment and recovery. We've helped to fund mental health services and education for our first responders to provide them tools for managing compassion fatigue. And we are partners with Catholic Medical Center in the provision of integrated primary health care for individuals in the community who are experiencing homelessness and may be struggling with addiction as well. In 2021, we helped to launch the state's first harm reduction strategy on the local level and are committed to actualizing its best practices for years to come. Our work is far from over, but I feel fortunate to have an army of community leaders who share in the vision of achieving a healthier community for all. We are here to instill hope and, most importantly, measurable change for the better. Thank you.
Anna, thank you so much for speaking with us today and for everything you do every day for the citizens of New Hampshire. Next up, we are pleased to introduce Jessica Bennett, who is a drug and alcohol counselor at Bedford High School in Bedford, New Hampshire. Ms. Bennett is a licensed clinical mental health counselor, as well as a licensed alcohol and drug counselor with over 11 years experience working with individuals, families, and couples. She has a passion for helping people of all ages learn to manage their day-to-day stressors. Ms. Bennett's work at Bedford High School helps students gain a well-rounded education through unique and exciting learning experiences in a nurturing and engaging environment. We turn it to you, Jessica.
Thank you. So my name is Jessica Bennett. I am a clinical mental health counselor and a licensed drug and alcohol counselor, as well as a certified school counselor. And currently I am working at the Bedford High School in Bedford, New Hampshire, as kind of a half school counselor and half drug and alcohol counselor. So through my role as a drug and alcohol counselor, I do a lot of prevention-based programming. Prior to coming to Bedford, I worked more in the treatment side of things and the recovery side. So I kind of switched gears a little bit to work more on the prevention side of substance use, which has really been an eye-opening experience for me. I work really closely with our health teachers through our wellness program here at the high school to really make sure that the programming that we are doing in the classroom with the students really hits kind of the main things, the main trends, the main data that we're really seeing out there in real life. So we rely really heavily on youth risk behavior survey data that we get. We do that survey every 2 years. There is a small committee of us that will sit down and really kind of dig deep into what our students are reporting, which really helps us to ensure that we are educating in the way that makes the most sense for the students and really kind of bringing in those real life experiences for them so that it hits home. They understand that more than just the how to say no, but really what it does to their brains, to their bodies, the social aspect of it and the social influence that it brings, and really just making sure that we give them the tools that they need in order to be able to go out there and think through those difficult situations and come out on the other side of it and really feel like they have the ability to walk away from a difficult situation or to get help for a friend or a family member if they feel like they need that. Another piece of our education here in the district is that we have worked with the New Hampshire, Breathe New Hampshire. We've worked with poison control. We've worked with a few different programs locally, and we have been able to bring kind of 2 programs to our younger levels, which have been really great. So we do an over-the-counter medication safety with our 5th grade students. So it's a peer-to-peer program. So we have high school students that are trained in the curriculum that will actually go down to our intermediate school and deliver the lesson to them, which has always been really well received because it's different than just a teacher standing in front of the room talking at the students. It's a student that was sitting in those seats not long ago that is almost kind of feels like a celebrity to the kids. They really look up to them. So that has been a really great experience, a different way to deliver the information that's really important for them to know. And then we also started doing a vaping curriculum for our 6th graders. Again, it is a peer-to-peer program. So we have students that are from the high school that will actually travel down to our intermediate school as well and meet with those 6th graders and deliver that through their health classes and kind of what to know about vaping and how to get yourself out of difficult situations and all of the peer stuff and the social influence piece of that as well. But it's been a really eye-opening experience, not just for me as the kind of the facilitator of it, but also for our high school students. The students that have gone down there have really kind of put themselves out there and opened this door to be someone that the younger students are able to kind of look at and go to. And it kind of paints them in a different light as well. It reminds the high schoolers that there's a lot to lose and there's a lot of eyes on them. A lot of the students that we have had trained have been student athletes. So there's kind of that added level of responsibility that's kind of naturally there, which has been really great. We do a lot of partnering with our community coalitions. So Making It Happen, which serves the greater Manchester region, has provided a lot of great opportunities like the connection to the folks at CADCA for our students and for myself personally and other staff. We've been able to attend trainings and access a lot of the information that's out there that's just so helpful, as well as Bedford Coalition Be Bold. We have been able to do events in town to really bring awareness to the prevention piece from the community perspective. So I think it's really been helpful to kind of have both the community and the school pieces kind of come together. And I love being able to kind of bridge that gap and kind of have one foot in each place, which I think has been really great. At the middle school, we have a master's level LADAC, and then I'm the LADAC at the high school. So in district, there are two of us that work really hard on the prevention programming. We do family meetings with students, we do individual meetings, we do groups, we do kind of everything in between. And then kind of on the other side of that, our nurses, at least at the high school, are trained in and have Narcan actually here at school, which I think people would be surprised to know. There's always kind of the risk, no matter where you are. We've been seeing, not just here in Bedford, but, nationwide, an increase in substance use, the young and younger, which is why we're really kind of trying to start from 5th grade on about the education piece and knowing how to access your resources and knowing who those people are that you can go to. But I think it's important that, people are able to be identified at each school, who is your person that you can go to, and just knowing that the need to have support is there. Vaping has been a big issue that, a lot of schools have been seeing. And unfortunately, we've kind of jumped right back into kind of the abuse of, pills that have been, kind of man-made, kind of on the streets that you don't really know what's in there. And when you open the door by starting to use really any substance, whether it's nicotine or THC, you're really opening that door for other mind-altering substances. So we're working really hard to kind of stop that before it even gets to that point of students using. So, we're constantly figuring out, what's going on in our community, what's going on in our state and regionally and beyond, to make sure that we're hitting those marks and we're listening to our students and we're really hearing those concerns, and we're supporting them in the best way that we can.
Thank you so much, Jessica, for your remarks today, and for helping nurture and protect our high school students. We truly appreciate you being here with us today. For our last speaker tonight, we will hear from Brian Mooney, who has served as the Community of Care Manager with Making It Happen since 2019. In this role, Brian contributes to the continued advancement of the Substance Use Disorder Collaborative, develops new partnerships, and promotes policies and practices that make healthy living a possibility for everyone. He leads Making It Happen's efforts in the development of a regional recovery-ready communities model and serves as the regional liaison for the business sector and the New Hampshire Recovery-Friendly Workplace Initiative. In addition, Brian serves as the Continuum of Care facilitator for the Greater Manchester Regional Public Health Network. Previously, Brian was the executive director of HOPE for New Hampshire Recovery, a network of community recovery organizations serving the state of New Hampshire. He has a background in hospital financial management, healthcare analytics, and healthcare reimbursement systems, and holds a bachelor's in health management policy and a master's degree in health administration, both from the University of New Hampshire. He is a United States Air Force veteran, medic/firefighter, and served during the Gulf War in the Pacific, Europe, and throughout the continental United States. We're excited to hear from you, Brian.
Good evening. My name is Brian Mooney with Making It Happen, and we are the Regional Public Health Network located in the Greater Manchester region. There are 13 public health networks across the state that are doing great work in prevention, harm reduction, and across the continuum of care for substance use disorders and alcohol, tobacco, and other drug prevention. I'm here to talk about harm reduction and some of the work that we're doing in the region to prevent overdose fatalities. As most people know, there's a significant spike recently in the number of these cases in the city, and a lot of emphasis around how do we prevent overdoses and help walk people towards better health. And that's essentially what harm reduction is. We define it as prospective risk reduction through a set of policies, practices, and programs. So common examples of harm reduction are when people engage in risky behavior. There's things that can be done to help reduce their risk and reduce the harm that they're doing potentially. So examples of that are everyday examples of that include things like sunscreen and seatbelts and speed limits. Police officers wear a bulletproof vest if they're in a dangerous situation. That's a harm reduction measure, just like firefighters wear bunker gear, helmets, gloves, boots. They're steel-toed when they go into a structure fire to help reduce the amount of harm that they could potentially do in their work. Harm reduction also applies to people who use drugs. And with the current crisis with overdoses, we're doing everything we can to implement harm reduction measures in the region. And some of those things that we're doing include distributing naloxone, which is a life-saving intervention that reduces the impact or the physical attributes of an opioid overdose. We have fentanyl test strips. We have leave-behind kits. There's a great partnership in the city where the health department works with the police department. And after an overdose, they go out within 72 hours and meet with that person and their family and provide some of these harm reduction measures for them, including information on not using alone and educating family members on how they can potentially save a life. We also work with a program called the Recovery Friendly Workplace. And that is educating businesses around the continuum of care for substance use disorder across prevention, treatment, and recovery, but a focus on having parity with coverage between mental health and physical health, and educating employees on some of the things they can do, because addiction impacts almost every family. And so there's a lot of great work that's being done in the region, and this venue tonight is to share some of that work and hopefully interest people in learning more and partnering with us and other organizations in the city to implement some of these harm reduction measures. We've never seen anybody that wasn't alive get into treatment or get into recovery. So we have to do everything we can to keep people as safe as possible if they cannot or will not stop using drugs. There's been about a 2-year effort around this that's really advanced significantly. And so we're really proud of the work that Making It Happen is doing in the region, our health department, and all the 13 regional public health organizations. So thank you for your time, and feel free to contact me at brm@mih4u.org.
Thank you, Brian, for speaking with us tonight and for being our co-host tonight. It is an honor to work with you and the team at Making It Happen. Thank you to all of our speakers this evening. They are all doing so much to raise awareness and expand services in this challenging environment. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, which includes the use of virtual reality. The VR program was developed as a tool for training that was designed to help replicate unique, challenging training situations, those that are hard to replicate in a classroom. settings such as Black Friday trainings and simulations. This technology led to the development of non-retail trainings, such as the VR we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey, you okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication, When opioids and benzodiazepines mix, the results can be deadly.
What's your emergency?
Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Walmart team for developing this powerful tool. We're so excited to work with you to connect this to community members. We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. Please reach out to us at CATCA at any time with suggestions and questions. My name is Reiko Mendoza, and you can reach me or any of my team at rmendoza@catca.org. And look for us to be reaching out to you to discuss this more and get tremendous feedback and suggestions from you. Thank you so much to Making It Happen Coalition, our co-hosts this evening, and wonderful friends. We are now through the hour, and we will conclude the webinar, and we wish you a great rest of the week. Thank you.